With almost 1 million new infections each year, HIV/AIDS has become Africa's greatest threat. It's time for a new approach. It is common knowledge that healthcare in Africa faces severe infrastructural challenges, especially within rural and low-income communities who are the most at risk and the most in need. Extreme poverty, low levels of education, and a lack of basic service delivery have all contributed to sub-Saharan Africa accounting for an estimated 2/3 of all people living with HIV. To tackle this epidemic, the South African National Department of Health has adapted its policies to align with the UNAIDS scaled-up 95 principles. 95% of people should be tested and know their status. 95% of eligible HIV-positive people should be put on treatment, and 95% of those on treatment should have an undetectable viral load. Realistically, in a country where something as simple as access to clinics cannot be taken for granted, how can the 95 principles be achieved? Technology and data. Recent developments by global players including Microsoft have provided the infrastructure for companies such as Qode Health Solutions to develop next-gen solutions to support public health programs delivering HIV/AIDS testing and counseling to some of the region's most at-risk communities.
At Qode, our mission has always been to enable people to live better lives. We are deeply invested in understanding challenges that developing countries face. Our global software certifications and expertise enable us to develop clinical and health program management systems that are adapted to real-world risk. Our product supports initiatives like mobile clinics with real-time data collection, allowing community healthcare workers to more efficiently and effectively treat patients. Our solutions provide healthcare programs with the necessary tools to improve service delivery and quality of care, allowing them to maximize the number of patients they can support.
Many communities that need our help are very far from traditional clinics and weren't able to reach them before. With Qode products, we can now go to them and test them in their own areas. With the technology they have given us, we can get patients' records at a click of a button and test results are almost immediate. Now that we have less paperwork, we have more time for our patients. We can also collect data like patients' vitals, TB and STI screening information. The Qode Insight system now collects data from many clinics, allowing us to easily follow up on patients that have tested positive but aren't getting care.
Data-driven decision-making and developing technology is one of the most powerful weapons we have in the fight against HIV/AIDS in Africa. We have developed Knowledge Center for exactly this reason. It is a big data solution hosted by Microsoft Azure that automatically consolidates program data into static reports for routine reporting and dynamic dashboards for monitoring and evaluation teams. Knowledge Center supports thousands of HIV-related healthcare facilities and programs across South Africa, Zimbabwe, Zambia, and Botswana. We hope to soon expand to Malawi, Uganda, and Nigeria in our efforts to make the 95 vision a reality. Trust technology, trust experience, trust Qode Health Solutions.